All right, one of the things I want to talk about, because I don't feel like I spend enough time educating patients on it, is injectables. You know, as a surgeon, we do so many different things that injectables are just kind of like, yeah, that stuff we do in the office. And sometimes we don't spend enough time telling our patients, clients, and those of you that we don't know yet, the pretty amazing arsenal of things we have that we can do in the office now to make you look better without any preparation and hardly any recovery, maybe a little bruising or swelling. It's pretty amazing. So, 15 years ago, we had Botox and we had a couple high hyaluronic fillers and maybe a couple thicker fillers. Now we have a whole arsenal. Every line of products has different thicknesses of filler to use in different parts of the face. And that really helps us kind of use it as paints to kind of get the best result we can get if we're trying to get cheek volume, we're going to use something thicker and we're going to go deeper, kind of like making the bone fuller. If we're trying to get little lines, we're going to use a real thin hyaluronic acid filler with a low G prime that really moves around very liquidy. If we're trying to get the middle folds, like the nasolabial folds, or trying to hide the jowls by putting some filler in the pre-jowl sulcus between the chin and the jowl, we're going to use something kind of medium thickness. There's a few that I'm a big fan of, but they change every 6 months or so as new products come out. And so when we see a patient, we a lot of times speak in generality before telling them exactly which filler we want in each location. And sometimes we're going to recommend more filler total than a patient thinks. Patients will come in and say, "Oh, I just want to try a vial of filler. I've heard you can get one syringe and the price is this, and I want to do my cheeks and my lips and my jowl." And unfortunately, that's one syringe is 1 cc, 1 milliliter. I mean, if you have a Coke, that is 240 milliliters. So it's not very much. It usually takes multiple vials of filler to kind of treat multiple areas. Now, if we just want to treat one area at a time, one vial is probably okay. The most common places we typically start is fillers, usually in the lips, is a very common thing for younger patients. And of course, one of the first things patients need filled for aging is the nasolabial folds. But like I said, it's kind of artistry at work, getting to use these different fillers. Some can make it look like your bones have gotten fuller. Some can help with weight loss. And we didn't even discuss neurotoxins. There's really multiple brands of neurotoxins. Everybody knows the word Botox, but there's Nutox and Dysport and Xeomin and multiple, and we can use those to relax the muscles we don't need that are causing repercussions, such as causing wrinkles or fighting muscles in a give and a take that are leading to a physical stress that lead to other wrinkles. So the most common wrinkles we'll relax are in between the eyebrows. There's two muscles, corrugator and procerus. Each of them are a paired set of muscles, and we really don't need them. When I do a lot of my brow lifts, I take out as close to 100% of those muscles as I can. You will never miss having those muscles in any circumstance. And if we relax those muscles, the big, large muscle in your forehead called the frontalis doesn't have to fight as hard to raise your eyebrow. So therefore, it raises your eyebrow, and it does it without having to fight, which leads to those transverse lines in your forehead. So that a lot of times just relaxing right here can smooth the whole forehead. As patients get a little bit older, we have to add some neurotoxin to the frontalis to start to weaken it. I don't like to totally paralyze the frontalis. I like to keep some motion of the forehead and the eyebrows. But certain patients do like it totally relaxed. So we'll kind of walk through that with the patient and get them where they want to be. Another common place for neurotoxin is in the lateral orbit, the crow's feet. We get them when we smile almost all the time. But if they're there at rest, it's probably time to treat them, because those are going to cause a permanent crease that's going to get worse and worse. And with just very superficial injections, preferably with a neurotoxin that spreads a bit more, we can inject that area. And when you relax that muscle, it is a sphincter. It's a circle, kind of like this. And as it squeezes down, it makes the crow's feet. It's pulling your eyebrows down, and it's kind of closing down this tunnel. So a lot of patients feel more open when you relax that. The crow's feet look better, and the lateral brow goes up a bit. So it's a very nice treatment to do. Some of the other common places we'll use neurotoxin. If your corners of your mouth turn down and you kind of scowl all the time, there's a small muscle called the depressor anguli oris that we can try to relax. We don't want to hit it completely out, but if we hit that wisp of a muscle and relax it, that corner will move up a millimeter or two and hopefully get to neutral. It's not going to turn up or look crazy or look like the Joker, but it can help a lot. Another place we will use what I call micro neurotoxin is around the mouth for the smoker's lines. Smoker's lines occur whether you smoke or not as your skin thins and those muscles get stronger and the fat in our face starts to go away, either because we're getting older and thinner or because we run or exercise, or sometimes it just happens. And if we can relax those muscles, those wrinkles will relax. But we're very careful around the mouth. So that's why I call it micro neurotoxin, because if you put too much, it could affect your smile or how you talk or how you whistle. But we want to put just enough to smooth things out without affecting the function of those things. And there's a few other places we'll use neurotoxin, but that's kind of the bread and butter that we do every day. So I know sometimes we explain things in too much detail, but the point is neurotoxins and injectables, all these fillers, we have a variety of things we can do to help you. And we didn't even touch on all of them. There's other things such as Sculptra and fat grafting. And so we're happy to see you in consultation and discuss that with you. We're not going to pressure you into any sort of decision. We're going to recommend what I think would address your needs, and we can kind of do it all at once, or we can do it over a set of different days. So thanks for listening.